England Cancer Alliance. I'd like to welcome you all to this 10th session in our series, Let's Talk About Cancer. The subject tonight is cancer and menopause. So we'll get onto it very shortly, but there's a little bit of housekeeping. The first half of the meeting, that will be talks by Dani and Laura Woods. You can see Dani there with her logo, and Laura's now waving. The first half will be recorded, and the recording will go onto the Alliance website. So while the first half of the meeting is in session, if you don't want to be found on the East of England Cancer website because your picture will come up, then you can turn off your camera. But I'll give you another notification at the end of that session to say you're safe now, you can put your camera on. We won't interrupt our speakers with questions, but what I do ask you to do is, as questions occur to you, would you please put them in the chat? And Jane Parker Coulson, who's the patient involvement lead for the Alliance, will moderate those questions in the second half. However, once we've got through those questions, you're very free to put up a hand, and or during those questions, if you've got a supplementary, use the Teams function to raise your hand, and we'll go to your question. I don't think there's anything else to say, is there, Jane?
No, I think that's everything.
Good. In that case, without further ado, I will hand you on to Dani Bennington of Menopause and Cancer to start us off. Thank you, Dani.
Oh, thank you so much, Ray. Thank you, Jane. Good evening, everyone. My name's Dani, and we'll also be hearing from Laura. Thank you, Laura, for joining us today, which is great. A little bit about her own story. I'll share a little bit about my story, and I'm going to just see if I can share my slides with you and if I can let you into my computer. Are you in? Are you in my screen? Yeah, perfect. Yeah. So welcome everyone to this evening's session. My name is Dani Bennington, and I have founded a not-for-profit organization called Menopause and Cancer. I'm also the host of the Menopause and Cancer podcast. I'm the author of a book called Navigating Menopause After Cancer. And I'm going to let you into our world a little bit today. For some of you, you might know lots about the impact of cancer treatment on the menopause for people of all ages after all different types of cancer. And for some of you, there might be some new nuggets of information here. So feel free to ask me any questions afterwards. I'm not here to really talk at you. I just want to let you into our world a little bit. I put that as my sort of like title here as well. Not a single week goes by where I'm not outraged at the lack of support and the lack of people and the lack of care people get when navigating menopause after cancer. And I put that on my slide about 5 years ago when I first embarked on this work. And I keep it on there because not much has changed, although we have made great progress, and I share that with you as well. At our organization, it is our mission to bring together a community of experts with our community of patients to provide them with the information and support they need and deserve. And I just want to go back to the basics of what is perimenopause, what is menopause, and why am I here to talk to you about menopause after cancer today. So menopause is just a moment in time. We diagnose it in retrospect. It's when a person's periods have stopped and the person hasn't had a period for over 12 months. And it usually affects people in the UK with ovaries around the ages of 45, between 55. When it happens earlier, we call it premature menopause, or POI, premature ovarian insufficiency. And the lead up to this is perimenopause, and that can be a stormy time as well for people. It can last up to 10 years. Hormones go on a roller coaster, and around the time of menopause, hormones really start to decline. But the lead up to menopause is called perimenopause. Just try and go back to my slides. There we go. As you will all be very much aware, whether you are a person with ovaries or not, whether you live with a person who might be affected by perimenopause or menopause, many celebrities all across the world, many people in the public life are talking about the menopause. We've got Oprah Winfrey on here, we've got Davina McCall on there, we've got many people talking about the menopause. However, people with a history of cancer are the forgotten group when it comes to talking about the menopause. And I'll tell you why that is. Menopause after cancer is different. But before I tell you why it's different, I'll tell you how it's triggered. And I know a lot of you will know all of that, but I really want to make sure I cover it just in case. Cancer treatments can trigger the menopause. So chemotherapy, surgery to remove the ovaries, radiotherapy to the pelvis, endocrine therapy treatments, which are often prescribed to breast cancer patients and are taken 5 to 10 years after active cancer treatment finishes. And that can happen at any age and after any type of cancer. One stat I need to give you today is about 90% of all people affected by cancer treatment over the age of 40 will enter permanent menopause. So if you know of a person that is over the age of 40 that's had any type of these cancer treatments, 90% of them will be put into the menopause because of their cancer treatment, and 40% for those under 40. So we're looking at a huge amount of people, for women that have had cancer treatment, whose treatment put them into the menopause. And it's different because these menopauses they come on and they're onset in a much more abrupt way. It doesn't take 10 years like perimenopause for the hormones to dwindle. They can come really quickly. I personally had surgery to remove my ovaries. Well, from one moment to the next, I was living in a postmenopausal body. That means symptoms can be more severe. Patients have a lack of preparation. These types of menopauses can be more complex to treat with limited treatment options. People also have to navigate the long-term impact of premature menopause. So bone, brain, and heart health is something we can't not look at because we know early menopause leads to a negative impact on long-term health. And when cancer treatment ends, menopause goes on for the majority of people for a very long time. And this is the picture that most patients explain to us, sums up their reality, is when they feel like the end of active cancer treatment is something they want to celebrate with their families, with their friends, with their employers, and they're looking forward to returning back to a normal life. That is the time when people realize, oh my gosh, I am now walking around with a suitcase full of symptoms. I thought they were to do with my treatment. They're not getting better. This is the impact of my cancer treatment making me menopausal. People have nowhere to turn to. Currently, menopause support in terms of menopause clinics or a specialist clinic within hospital settings is not part of any cancer and oncology care plans across the world. Menopause after cancer is the long-term, unspoken side effect of cancer treatment no one is talking about. And I will talk to you about some of the symptoms, and I think you probably know that, but I must hit home and I must bring the message home why this is so important. It's when people are starting to rebuild their houses and homes and their physical bodies and their mental bodies after cancer treatment. That is the time when they're then put into the menopause, or when they're realizing, oh my gosh, these are menopause symptoms. And all of those symptoms people currently feel they have to deal with alone, they can be very much impacting people's quality of life and long-term health. Insomnia, loss of libido, night sweats, and hot flushes. Dry, itchy skin, dry eyes, ears, and nails. Thinning hair, oral health changes. Headaches, heart palpitations, migraines, tinnitus, feeling dizzy. Changes to periods, vaginal symptoms. We also call them GSM, genitourinary syndrome of menopause. Reoccurring urinary tract infections, urinary symptoms, and the GSM symptoms are a whole bag, a collective noun of many different symptoms to do with the vagina, vulval, urethra, and bladder. Weight gain, restless legs, joint or muscle pain, more allergies, digestive issues. Brain fog, very common, we hear that a lot. Fatigue, poor memory, and poor concentration. mood swings, anxiety, irritability, and low mood. Lack of motivation, tearfulness, loss of joy, reduced confidence. And before I talk to you a little bit about the stats, just going back to the symptoms, we just don't know how a patient or a person is going to be impacted by these symptoms. Some people experience a handful of these symptoms and they get on okay. And some people experience many of these symptoms and they stop them in their tracks. For our patients who are on long-term endocrine therapy, this endocrine therapy makes them extra menopausal. It's like menopause on steroids. And the whole point of the cancer treatment, like tamoxifen or aromatase inhibitors, is to suck the last bit of estrogen out of a person's body to prevent the cancer from recurring or from stopping the cancer from growing. Many, many people find that these side effects of their cancer treatment drugs are so severe that about 50% stop their treatment because of menopausal side effects being too much. So we've all got to do better to help people manage these symptoms. Globally, it's 16.3 million women would be diagnosed with cancer by 2050. And if you think that of these 16.3 million women, for those over 40, 90% will become menopausal. We're looking at millions of women who will have severe quality of life problems and long-term health issues. The collateral damage of menopause after cancer is huge, and we won't be able to avoid it. In the UK, about 186,000 women are diagnosed with cancer each year, and the waiting list to see a menopause specialist can be up to 18 months long for those women that even know there is a menopause specialist. And a lot of the menopause specialists are not adequately prepared in working with cancer patients. We'll talk with Laura a little bit about that, how she felt, and a lot of general practitioners. For those people, we are too specialist a case. Oncology is there to save our lives, so we fall through the cracks. We also know that only about half of all of the oncology nurses currently talk about menopause. 3 things we hear every week. No one said that menopause would happen to me because of cancer treatment. I have no idea what my treatment options for menopause are. And menopause after cancer is harder than chemotherapy, radiotherapy, and surgery altogether. In fact, I've got stats from our research this year. 3 out of 4 patients have told us that menopause after cancer is harder than active cancer treatment. And that was done through our research this year with University College London Hospital. And you can find the research and the findings on our website. I'll share that with you a little bit later. I'm just one of the millions. There are millions of people out there, and I have connected with hundreds and thousands probably, and I was just one of those millions. My journey began when I had chemotherapy. You can never get 3 little kids into one picture. I hope for those with families, you will agree with me. So I've only ever had 2 kids in the picture, but this was 2 years after active cancer treatment. I had chemo, radio, and surgery, and my period stopped when I was going through active cancer treatment. Only I had no idea that was the menopause. I was told you will lose your hair to chemo, and I was told your periods might stop. I did not know what that meant. I didn't know that meant menopause. I didn't know that could come with symptoms. And you could argue that I should have paid a lot more attention in school in my biology lessons. Yes, maybe, but maybe I also needed a little bit more conversation. In my case, my periods came back, and after my active cancer treatment, my doctors told me that I'm also the genetic mutation carrier of the BRCA genetic mutation. And so then later I had my ovaries removed. I also had a bilateral mastectomy, and how those 2 surgeries were handled was very different. I was a very active participant in my choices around my double mastectomy. Did I want to go flat? Did I want a reconstruction? Did I want to keep my nipples or not? Are we going to use an expander for reconstruction, or are we going to go straight to implants? I was part of the decision-making process. When it was advised to me to remove my ovaries before my 40th birthday to reduce my risks of ovarian cancer, I was just told it's a small keyhole operation and I'd be in and out the same day and not to worry about it. But when you remember my first slide of all of those famous campaigners, these people were sort of talking on social media. They were saying, you know, the menopause could be a thing for people. People could have problems. And so I kept asking and asking my doctors, and I sometimes had no advice and I sometimes had conflicting advice as how I could manage my early menopause after my type of cancer. And that no advice or conflicting advice outraged me so much that I set up Menopause and Cancer, the organization, and we now, 4 years down the line, support in many different ways. Yes, we do raise awareness. This year, we launched World Menopause and Cancer Awareness Day, and with a huge media coverage reaching 37 million people in the UK. But we always knew we wanted to provide free, practical, and compassionate support that is a holistic menopause after cancer support. So people learn in different ways. They can join our award-winning programs or read fact sheets. We have a podcast every week. We have a podcast episode where we bring doctors on that support and really share their knowledge. We make YouTube videos for people with our doctors. We also are very proud that this year we've run our menopause specialist clinic. It's fully funded and free. We had a 22-year-old cancer survivor we met in Birmingham this year. She came to us with her mum after having had no help for 2 years. She had a rare type of ovarian cancer, and we were able to facilitate a space for her. Very recently, I was on a call with the Welsh Cancer Alliance, and there was a 19-year-old, and we're really hoping to bring her under our wings for people to really receive the specialist support and advice they need. But we also run retreats, community get-togethers, online workshops, and we also teach healthcare professionals through our CPD courses. So in whatever capacity you're here today, I hope that some of our services can support you a little bit, because we know you're busy, you're stretched for time, you have very little resources, and you are just so busy. So if you are supporting people with cancer, we hope that you can refer your patients towards our services, and they can then pick and choose what might be right for them at the right time. Sometimes people find us as they go through active cancer treatment, and sometimes they're 20 years on, believe it or not. So our doors are always open. You might think, what is it that you teach in those many programs and workshops and webinars? And so I'll just sum up very quickly what our Holistic Menopause and Cancer Toolkit is. It is inspired and informed by evidence-based solutions. We look at all of the facts from the British Menopause Society. All of our experts are British Menopause Society accredited doctors. They've put together these recommendations for us. They include lifestyle, they include non-hormonal prescribable options, they include complementary therapies, they include hormonal options, so that's systemic HRT and local HRT, and mindset as well, where we bring the community together. And if you think back to when I said to you, people usually say to us, they have no options. They just don't know what their options are. As soon as we talk through to them that there is a variety of things that we could educate them on, they're like, oh, wow, I didn't think there was anything I could do. My doctor said I can't ever have HRT, so I thought I don't have options. As soon as we open that toolkit a little bit, we also allow for the patient to think, what's right for me right now and what do I manage to do? Sometimes people are so exhausted, fatigued, and full of troublesome symptoms, we can't tell them to go and exercise and eat better. They've got no energy. Then they need a different strategy that helps them get off the ground. And then maybe later they can implement lifestyle or dietary options. But it really doesn't matter what type of symptom people present with, what type of cancer they've had. There is a range of symptoms out there, and we often expand the toolkit. For any practitioner, you'll know all of that. We have plenty of evidence for acupuncture, cognitive behavior therapy, CBTI, yoga, mindfulness. There are plenty of off-label, non-hormonal prescribable medications. And so we can go through them in a non-judgmental, in a non-hierarchy way, just presenting the evidence. All of this I've tried to put in my book. That was like giving birth to my fourth child. It was so hard to do. I had 25 amazing doctors write the book with me. We've looked at all the evidence. We've put all of the studies in. So it is a guide for clinicians and patients alike. And as I said, this year we launched World Menopause and Cancer Awareness Day. There is lots of focus on the menopause, and there are lots and lots of awareness days, and there's lots of focus on cancer. But the millions of people who are struggling for decades with the early onset or the debilitating symptoms of menopause triggered by the cancer treatment needs also a day. And so on the 18th of September, we launched the Awareness Day. I didn't know you could just do that, launch an Awareness Day, but it turns out you can. So next year, God knows what we're going to do, but this year we had a great time. Thank you for listening. I believe that every conversation brings with it the opportunity for change. I'm going to share just the one link with you today, and I'll put that into the chat maybe later, or if Jane wants to send it out, it's just menopauseandcancer.org. That's our website. On the website, if you're a healthcare professional, there is a tab for healthcare professionals. You can read our research, you can order leaflets, you can book our team in to do a lunch and learn for you at your organization to maybe just help you identify where can you signpost your patients to and how can you support a little bit more. That's it from me. And thank you very much. Laura, is your microphone on, or are you unmuted?
Yep. No, I'm good to go.
Can I just
Laura.
introduce you, Laura? Laura Woods is a member of the Patient Partnership Group, but she also works with NHS colleagues in Norfolk and Waveney. Over to you, Laura.
Thank you, Ray. Can I just check on timings? What, 10 minutes?
Yeah.
Yeah.
Laura,
Perfect.
when you watched the presentation as a patient with the patient's hat on, what sort of stood out for you? And then we'll talk about your story a little bit.
I think for me, seeing all that written and you going through all the symptoms and all, I was like, yep, we ticked all those. And I think it's normalizing it though. It's so rare to see, I guess, a presentation like that where you feel like actually that's me and I fit in that presentation. Because we know that there is very little, well, for me, there's very little information sometimes around. And as I said to you before, Dani, I stumbled across your website and Facebook page probably a year ago. And since then, it's been a massive support. So actually seeing the slides that you just presented resonated with me. And I just want to say a thank you for doing that for everyone that it will affect throughout the UK.
That's amazing. I'm glad. Are you happy and comfortable to share with others what type of cancer you were diagnosed with and how maybe that has triggered the menopause for you?
Yeah. So back in March 2016, I was diagnosed with stage 2B cervical cancer. So I had squamous cell carcinoma. And my only treatment options at that point were chemotherapy, radiotherapy, and brachytherapy. And it was a quick 2-minute conversation, I think, at the point where you go for planning and they sort of talk about everything. And it was like, oh, by the way, your treatment will, you'll become infertile. It'll put you into early menopause. Are you happy with that? Please sign here. And it was just like, what? And even though there was a clinical nurse specialist in the room, it just seemed like it felt like a throwaway comment, like this is going to happen, but actually, it doesn't matter. And I guess for me in that moment in time and being 30 at that point as well, I was not really thinking about that side of it. I was like, I want to get through my treatment. I want to be here. I had my daughter, I had my now husband with me. So that didn't feel like it was in my brain at that point. But I guess in hindsight, I needed that conversation there and then, and I didn't get it. And I think trying to figure that out afterwards was very difficult. Because again, with my treatment, I was instantly in early menopause. Like I was not in menopause like 1 week, and then the next week it hit me like a brick wall. And I think that again, it's just so difficult to sit with and understand, because you're like, oh, am I feeling ill because of my treatment and that's finished, or is it because I'm now going into the menopause? And I had no information given to me, nothing. It was just around, yep, can't have any more children. This is going to happen. Off you go.
Thank you for sharing that, Laura. You were ever so young, right? You think you were 30. That's like 20 years shy of the natural age of menopause. We know that has a not a very great effect on your lovely bones, on your brain and your heart health. For many types of cancer, hormone replacement therapy is a really good and safe option. But because hormonal health doesn't come in conversations, many people fall through the cracks, even if they could access HRT. How and at what point did you realize I need to ask someone for help? I need to see what my options are. Is this the menopause? How did you through a lot of self-advocacy, or how did that happen for you?
Yeah, it was definitely a lot of self-advocacy. I think at the point where I was told where my scans were clear and I was then classed as in remission, which was probably around the September 2016, and it was like, oh, you know, you maybe should take HRT, and it was like, but your GP can sort that, and you kind of sent on your way. And I think for me back then as well, there was still a lot of, I guess, those horror stories around taking HRT. And I think when you've had cancer, you're like, well, why would I take that? Or why would I want to like risk my chances of having another type of cancer? And I guess I just thought at that point, I'll be all right. I'll just get on with it. And I think it sort of, for the next 2 years, I kind of struggled a lot with brain fog, just sleeping, my mood, low libido, like I had every single thing going. And I think it got to a point where I was like, I can't live like this anymore. And I did reach out to my doctor. And the first thing the doctor said to me, well, are you sure you're in menopause? You're too young. I was like, have you not read my notes? And it just felt like I was being questioned. And they're like, oh no, well, we need to check, we need to do baseline blood. And I was like, look, I can 100% tell you, I am in the menopause. Literally everything internally has been fried. I had radiotherapy and brachytherapy. It doesn't work. And I think at that point, it did take a lot out of me, because it was just like, why do I have to keep explaining myself? Like, not only do I have to deal with the fact that I can't have no more children, and I'm going through this, I've now got someone questioning me whether I'm telling the truth or they think I've misunderstood. And I think at that point, I then realised how little some people, quite a lot of health professionals, don't know about early menopause, and especially menopause that is brought on by cancer. And again, that's when I started trying to figure things out, and that's why I found the Daisy Network as well, and they supported me to find information. And it felt like a good fight for about a year to try and get to see an early menopause specialist, which I finally did get, but I had to go back to my oncologist and ask them to do it, because I wanted the information. I wanted to know about HRT. I just wanted to know more. I didn't want to have to keep explaining myself. I wanted someone to sit down with me and tell me about it. So yeah, it was probably a year and a half. I then waited to see a specialist, and I got to see them twice.
And a couple of last questions, if you don't mind. Did you then find out, are you a candidate for hormone replacement therapy after your particular type of cancer?
Yeah, so again, not very much information, but was just told I could only take Tibolone, which is a synthetic type of HRT. There is only one dose, and it's not on the menopause prescription certificate, so it comes with a cost. So not only was I having to live with the fact that I have had cancer and now got all these other things, it was like, oh, I have to pay for that privilege now as well. So yeah, I've been on Tibolone for about 3 or 4 years now, and it's okay. I don't feel that I'm 100% back to where I am. Brain fog is really bad, which can affect work, and fatigue levels. Again, I have noticed the last sort of year that's been very difficult work-wise, and driving and anxiety. So I think half of my team might think I'm a bit crazy sometimes, because I might be in a meeting and I'll just go off on a tangent because I really can't remember what I'm talking about. So we'll have a laugh about it.
Yeah.
But HR, I think there's still more conversation that I'd like to have. And again, thanks for your support with that as well, Dani, is there are other options out there. But again, we have to dig and we have to find it. And that's now my next, I guess, port of call, is figuring out, actually, is there something else I can take, because this isn't enough.
Absolutely. Absolutely. Thank you so much. And I think what I would like to just sort of almost use your example to teach on a little bit. So we're looking at a very young patient in her 30s who's been pushed into menopause very quickly because of her cancer treatment. We're also looking at a patient where, you never know how many other underlying health conditions someone has. People might have autoimmune diseases, or they may have had blood clots in the past where they may not be a good candidate for HRT. But in Laura's case, you now know you were a good candidate for HRT, but the time it's taken you to notice what's going on, to think, oh my God, I need to do something about it. I can't continue living like that. To research and self-advocate, we're talking about years where you have missed out on a treatment that could have potentially really helped you with your quality of life and also helped you look after your bones, for example, because we know HRT is great for bones. And so because women's hormonal health isn't part of oncology conversations, we are making so many people miss out on accessing really vital treatments. And then it's about continuing to having to access, right? To think maybe I need a different dose or a different type of HRT, or my dose might need to be adjusted. And when people feel exhausted, I don't think the onus should not just be on the patient. We need to do better. And it needs to be a collaboration between patient and healthcare professional, but really the hormonal health needs to become part of oncology conversations. That is my view here. And it's ongoing, which is exhausting, isn't it, Laura? It's like so exhausting because there is no end. It's this, people often say, I've got this suitcase full of symptoms and I carry around like self-care burden with me as well, because I feel like I need to do it all myself. Laura, was there anything else you think you wanted to add from your story, or shall we look at a few questions together?
I think probably just saying it can be difficult sometimes because you get put in the menopause camp almost, but you don't feel like you necessarily belong there because of age and all the different things that are going on. And again, around having discussions around not being able to have children and all those different things. I think those parts that come with menopause can be really difficult to manage when you are, again, put with people who have entered menopause at a natural age, because they're things they're not thinking about. And so sometimes you feel like you're a bit of an imposter because you're like, oh, I've got menopause because of this. These people have gone through it naturally, and you just feel a little bit lost. And I guess and again, paying for having to for that HRT. But a good friend of mine, Joe, who I think might be on the call as well, has found some really amazing information that actually I should be able to get that for free because it is part of my treatment post cancer. So because of the after effects of cancer treatment, actually I should be entitled to have the prescription certificate for that. So I know Joe done some massive work on that, so it's really good to hear that actually I probably don't have to pay for it now every 2 weeks,
No.
2 months, sorry, because that again, it just feels like it's cancer. I always say cancer feels like it's the gift that keeps on giving. It's those unwanted gifts that you don't want, and it's finding people that understand and just going with that. And it is about self-advocacy, I still think, but we're making progress. As you said, it's small, but we're making progress, and I think we just need to talk more.
Yeah. Thank you so much. It's getting everyone involved, whether you're a participant or an observer, I feel, in this conversation. And I do think people will walk away from today listening to your story. They might remember some slides and think, oh, let's have a chat at work and how do we do things here? And has anyone talked about it? Thank you so much, Laura. You've had some really lovely thank you messages for being so open and what you are experiencing. Jane, do you want me to address a couple of the questions?